what is diet's role? And do you have a recommended dietary plan for someone that's looking to restore their hair?
Yeah, we do. Absolutely. Well, think about this for just a moment. The hair follicle is one of the most highly metabolic cell populations in your body. And it kind of makes sense. Like if, God forbid, you needed cancer therapy, that's going to knock out a lot of things. And of course, you know that it can disrupt your bone marrow. It affects your immune system. It, of course, can affect your GI tract, also another highly replicating layer of cells in your body. And of course, knocking out your hair, right? We see hair loss due to chemotherapy. And so anything that you do metabolically, whether it's dietary restrictions, if you're in a low fat, low protein, some other kind of special, even vegan or vegetarian diet, these types of things, or restrictive diet, you're trying to lose weight, you can impact your hair in a detrimental way if you're not doing it carefully. And probably it's most commonly seen in bariatric patients who have had surgery, like a sleeve of whatnot, or a bypass procedure for the purpose of losing weight. And honestly, a lot of those patients do come to me in that weight loss process because they're losing handfuls of hair. And it's because literally those hair follicles are starving for the protein and other things. So we definitely want to make sure that we provide good nutrition to the hair follicle right off the bat. So caloric intake is obviously important, protein in particular, because those are the building blocks of collagen. We actually have a collagen protein preparation that we prescribe to patients specifically who are interested in growing better hair. It's a tripeptide, a tricollagen peptide that we use. And it's really simple and easy. It dissolves in coffee or juice or water. It has no taste, no flavor, and you just drink it down. And it's super simple. I love bone broth, but I'm not going to be making bone broth every single day. When I break my fast, I'll have bone broth, but I like the scoop of collagen. It makes it simple and easy. And of course, as we age, our collagen levels decline every year. So our body just doesn't make as much collagen. And that's why our skin starts to sag and lose its resiliency, and hair and skin and nails, it's all related. So boosting with collagen. And these other, obviously there's multivitamins that are involved with hair, biotin and B complex is so important. But the other thing about nutritionals is that there's also some nuanced herbs. And I think that we've seen in the industry a lot of resurgence of kind of like, I would call it like ancient herbs, maybe even from the Far East, that we never really used for hair before. But now we know that if we can slow down inflammation or lower inflammation in the body, that we're going to help out the hair follicles. And there's curcumin turmeric that can do that. If we can do something to help us mitigate the effects of stress and cortisol, like use a stress adaptogen like ashwagandha or reishi mushrooms or other types of things like that, that would be great. If we are, let's say, not so keen on using an anti-androgen like finasteride because of potential for systemic side effects and things like that, and maybe you don't want to even put it topically, which helps mitigate that, but you want to use an anti-androgen, you can use saw palmetto. And that can be ingested or applied topically or in my shampoos and conditioners and hair care products. So, there's a lot of stuff that we have today to kind of help out the hair situation, immunity boosters so that we don't get, these biotoxins and infections, those stress adaptogens, so we can mitigate the effects of cortisol, those protein and collagen boosters, and the basic vitamins. We call that the A-list of vitamins, the top performers, and, heroes like biotin and things like that. So that kind of makes up my wellness system for hair. And, it covers really the high points when it comes to, nutritionally and nutraceutically, what would be important for somebody who's looking to grow is the healthiest, thickest, shiniest, longest head of hair that you could get.
What are your thoughts on products like Nutrafol that kind of do that, which are now, have nationwide commercials? I remember taking it a while back, and now it's huge and all over the place.
I'm a huge fan of Nutrafol. We prescribe a ton of it. A lot of stuff that I just mentioned, ashwagandha, curcumin turmeric, saw palmetto, the marine collagen, those are all ingredients in Nutrafol. So Nutrafol male is good. They have their own hair biotic. I have a probiotic that I like, that we have called the Good Guys, meaning those are the good bacteria in our gut to help out with hair growth. And there's been some really interesting studies on the microbiome of the gut and its impact on immunity and inflammation. as well as many other parts of our wellness. And the microbiome of our skin and our scalp is the next frontier. We're going to see a lot more research on that in the coming years. And I think that's going to be a big, big area of treatment and therapy for people, especially if they have some irritation or inflammation of the scalp. So I'm all keen on all of that. Yeah, I'm a big fan of Nutrafol. I was the first to prescribe Viviscal years ago, and obviously that's also a nice nationwide thing.
Mm-hmm.
You know, we couldn't get it here in the U.S. We had to import that from the U.K. years and years ago, and that was really a very specialty product that no one could get at that time. So kind of interesting stuff how it progresses.